Hi, my name is Anna and I'm a pelvic floor physio with Nose Creek Physiotherapy, and I wanted to chat with you today about dyspareunia. Dyspareunia is the medical term for having pain with sex, and it's a very common thing. Anywhere between 1 in 10 to 1 in 3 women or people who are assigned female at birth will have pain with sex at some point in their life. And even though it's very common, it doesn't mean that it's normal, because there are things that we can do to stop it. So what do we do in physio to address painful sex? First, we try to figure out the root cause. And so for a lot of people, this is going to be due to excessive pelvic floor tension. This is something that doesn't really get a lot of airtime in the media. We often hear things about getting loose after giving birth or loose as we age. But it's just as likely a problem to have muscles that are too tight. And this can cause that pain with that initial penetration. So in that case, we work on stretches, breathing exercises, relaxation exercises to try to get those muscles to relax, to allow for penetration. Some people also will have pain with deeper penetration. This can be due to something like a prolapse, which will be coming in the newsletter next week, or increased abdominal tension, in which case, again, we work on releasing those muscles with stretches and relaxation exercises. And then what can you do to start helping yourself at home? So one of the most important things for releasing pelvic floor tension is going to be paying attention to your breathing. In this society, women especially are always taught to look as thin as possible. We tend to really suck our stomachs in, kind of all up into our rib cage, and not let them move throughout the day. This makes it so that we breathe high up into our chest. And so one of the best things we can do for pelvic floor tension is to breathe deeply into our abdomen and into our pelvic floor, which I'll show you about coming up here. So the first thing we're going to practice for starting to help treating yourself at home for any pelvic floor tension is going to be just to practice doing our diaphragmatic breathing. And so that's a big fancy word for taking those deep belly breaths. So when you're doing this, I want you to focus on not pushing your stomach out, but just allowing air to flow into your stomach, because a lot of us tend to breathe really high up here, okay? So it's easiest to do this while lying down. So what you can do is put one hand on the side of your ribs here, and one hand on your lower belly. And then as you breathe in, I want you to try to feel like the air is flowing into your two hands, so the belly rises a little bit, and the ribs expand out into your hand a little bit, okay? And while you do that, it's good to focus on what you feel happening to the pelvic floor. So when we breathe in deeply, the pelvic floor actually drops down a little bit to help make space for that air going into this whole abdominal canister. So then as we breathe back out, you feel the pelvic floor rise up just a little bit. It's a good idea to practice this type of breathing for about 5 minutes a day.